We're really lucky here at Marjon to have a wide variety of clinics. And I think that's our real strength. The clinics have a very hands-off approach, so you're quite independent to work with people, but with that kind of safety net in the background. So it gives you a chance to find your own style, to try and apply the knowledge that you learned through your degree in a kind of practical way, but without somebody kind of hovering over the top of you. But you always felt like there was somebody around to ask for help if you needed it. And that really built my confidence, particularly working with people and building the communication skills that I think are really necessary for this kind of role. It can be a wide range of environments as well, both in like a hospital, more clinical setting, but then also we're out community venues too. So here at the university, but even things like village halls, we'll run some of our clinics there too. So that real kind of mix really gave me a lot of experience, a lot of confidence, and just kind of helped solidify the skills that I needed to do the role too. I think we're really unique in the opportunities that we provide to get kind of real world experience that not only builds yourself, but also helps with your employability too. I think we have a real unique mix that I haven't heard about elsewhere, and the kind of breadth of different clinics available really can add to your experience at the university. I think it's not just always one certain degree as well. It's we accept people on from a wide variety of degrees, so it can be from the more kind of sport related degrees all the way to the more health related degrees, and then that mix as well gives the students a chance to learn from each other, which I think is really valuable.
I think what the good thing about the clinics is that if you wanted to specialise in a particular area, it allows you to specialise. But if you're not sure and you want to dip your toe in, you can kind of try the different clinics and see how they work with you. But I think it gives you quite a few opportunities, the clinics, because essentially I think you go into health and wellbeing to help people, and so right from the get-go, from year one, you're given the opportunity to go into the clinics, which I was amazed by. I didn't expect it for year one being involved in the clinics, but there's such a variety of things that you do in the clinic. So they don't just come along and you kind of give a program and that's what you go away with. It's about helping people to try out different things, to become more physically active and have the confidence to be active, and they get to try a range of different things. So we're not saying, okay, do all of this and this is what's going to work for you. It's try this and see what works for you, see what tools you can put into your toolbox to help you moving forward. So I was really impressed with the kind of variety that's in the clinics.
I'm really pleased to say that they've given me sort of ways to manage my pain here. They have now had a different perception on activities that I can do, whereas once I was afraid to do it because thinking I would get into that pain and couldn't do anything. So the mindset now has changed to allow me to try a bit more, try a bit harder, which was really good. So we can identify with each other about what our conditions are and how we manage our pain. Because I think sometimes the doctors don't understand the pain you're in, and it's lovely to come and talk to people and find out what useful things they do so that we can share that together. It's really been a good 6 weeks in-depth course with the professionals there to guide you every step of the way.
I've been coming since last June and I've noticed quite a significant improvement in my health. I also suffer with asthma, so the exercises we do here actually are really good for that, and I've lost weight. So, it's been a win-win for me all around. Well, I used to manage staff occupational health, so I used to see a lot of people who became injured at work, nurses in particular with back injuries, and I very often saw them retire rather than actually try to get fitter and compensate, if you like, for the wear and tear on their bodies. And there didn't seem to be anything out there really quite like you're doing here at Marjon's, which I think is a great step really for people who are still at work but actually want to get better, more rehabilitated and fitter.